My name's Erica McLean. I am a speech pathologist and an instructor in the Communication Sciences and Disorders program. I am going to give you just a brief overview of the goal of this Texture Day and why it's important to all of our disciplines to be involved and work together and just have a basic understanding of how does this apply to me, but also how can we work together as a team for patients that we might see in this situation. So one of the things I wanted to start with is just to kind of familiarize us with what are different textures, what are modified diets, right? So one thing that we see specifically in speech pathology are patients that have trouble swallowing certain textures, and so we have to change the texture of their food to make it easier to swallow or safer to swallow, or something along those lines. So one of the reasons we might do that is if a patient has a stroke and their muscles aren't working anymore, or one side of their body isn't as strong as it used to be compared to the other side. Sometimes that can really affect their swallow. So when they try to swallow something, it doesn't go down right. Sometimes it can get stuck in their throat. Sometimes it can go into their airway and into their lungs, and they can get pneumonia that way. Sometimes they don't have good coordination of their mouth or their lips, and food can fall out the front of their mouth as they're chewing or trying to prepare that food. One reason somebody might have trouble swallowing is if they have a disorder like Parkinson's disease, where they just have movement trouble and can't kind of coordinate that. We can see swallowing trouble in patients that have dementia. They can have difficulty remembering the sequence of how to get the food from the plate into their mouth, and then the sequencing of how do I chew this food and get it to the back of my throat to swallow. We can have patients that have been in a motor vehicle accident or a traumatic brain injury, have difficulty. We can have patients that really don't have a specific diagnosis, but are just having increased weakness as they age, or just increased weakness overall that's affecting their ability to swallow. So we can change the level of food, like the actual solids, or we can change the texture of the water or the liquids that they're drinking. And so the purpose of this event is to get familiar with the different kinds of textures, the different terms that we might use. So when you're out in the field seeing these patients, you recognize those terms and kind of have a basic understanding of why is a patient on this diet. So one of the things that one of the goals of this experience is to learn what does my discipline have as a role in modified diets and thickened liquids, and what do my colleagues, right? My other friends in different disciplines, what are their roles in modifying textures and thickened liquids? So for the experience that you guys will participate in, we'll have speech pathology, occupational therapy, nursing, nutrition. We might have a couple different other departments pop in, but those are the big ones that we really want to focus on. And so let's kind of go through what might that look like. So for a speech therapy standpoint, we're really concerned about swallowing safety and anatomy. Is anything hurt or broken or not working the way it's supposed to? For occupational therapy, we might be looking at the patient's positioning, their trunk control. Are they able to have steady trunk control to support healthy positioning for eating? Sometimes after a patient has a stroke, sometimes they suffer with one-sided hemiplegia, where one side of their body isn't quite working just right. So that can really affect their feeding skills and their swallowing. So we might see patients in occupational therapy for that aspect. Another way that occupational therapy can be really involved in these patients that have swallowing troubles that need thickened liquids or modified diets is they can help create adaptive equipment or specific utensils that a patient can use to help facilitate any breakdown in the system. If they're having trouble with feeding, the plate to mouth excursion, they can have adaptive equipment to help with that. They can have adaptive equipment for even swallowing. They can have cups that have different paces, so it only allows you to take so much of a drink at a time. And occupational therapy is really going to be a leading force in helping the team figure out what adaptive equipment will be helpful with these patients. So not only can they help with positioning and trunk control and strength that way, but they can also be a really great resource for adaptive equipment and how do we use that equipment. And so we really want to use our OT friends for that. Of course, for nursing, they're going to be the ones with the patients most of the time, if not all of the time. So they need to be able to know, is this patient on a modified diet? Do I have to bring them, when I bring them the pitcher of water, is it regular water? Do we need to change the texture? Is the patient able to take their medication normally? Sometimes we have to crush up medication to where it's more of like a powder, and we can mix it into an applesauce, and the patient will take the medication with a spoonful of applesauce that way. Sometimes we'll have to cut the medications in half if the patient doesn't have a strong enough swallow to really push down a whole capsule, or a whole pill. And so we want to kind of work together with that. If I, as a speech therapist, change a patient's diet, I want to make sure I'm communicating that with nursing, so when they go to do their med pass, we're all on the same page. Or if nursing notices a problem with a patient swallowing, they do a med pass and the patient's really struggling to get the pills down or chokes on the water, I want them to be able to communicate that with speech therapy, so we can go do a more in-depth evaluation to figure out, why is that patient having trouble with medications. Nutrition is going to be a huge team player in a patient that has a modified diet, because sometimes if we change a patient's diet or change their liquid texture, that might change their overall intake of food or liquid, and we want to make sure that the patient is getting the just basic caloric intake that they need. But sometimes their macros, right, might change. They might need more protein, or they might need to have a different equation to make sure that their overall health is covered with their nutrition and hydration. So anytime that we're changing a patient's diet, we want to make sure that nutrition's there, so they can make sure that the patient's caloric intake and needs are met. So what does that look like? What are some textures or diets that you might hear? So let's start with the liquids. So a regular liquid, like a regular drink of water or your cup of coffee in the morning, even a Dr. Pepper, a soda, that's going to be called a thin liquid. That's our baseline liquid. That's everything that we're kind of starting off. A thin liquid is just normal liquids, right? So if a patient's having trouble swallowing that thin liquid, sometimes it goes too fast when you kind of swallow it, especially if you take a drink from a straw. It just really shoots it to the back of your mouth. A lot of times what we can do to slow that down is make it a little bit thicker. So a thicker liquid will move more slowly, is the theory. And so we can add thickening agents to the water or coffee or Dr. Pepper to make it a little bit thicker, a little bit heavier. So the next step up from a thin will be a nectar thick. So it's like the consistency of a nectar juice or a buttermilk, or you can think of tomato juice or something like that. That would be the consistency of a nectar thick liquid. Okay, the next step up from that, if that is still not working and that's still too fast for the patient, we can go up a level to what's called honey thick liquid. And that is what it sounds like. It would just be as thick as honey. So if you picture a honey bear, or like a bottle of honey, if you were to squeeze it out into a cup of tea or something, it takes a little bit of time for that to come out of the bottle and into the cup. It's a really slow moving texture. So that would be a honey thick liquid. It's fairly thick. And so now we're starting to run into problems. Will a patient drink that? Will they think that's gross? We have to kind of have those conversations too. So honey thick liquid is thick, but we can even go one step further into what's called pudding thick liquids, which is basically what it sounds like. Your water is now the consistency of pudding. And so essentially you're drinking your water with a spoon because it's as thick as pudding. If you tilt it like this, it's not really gonna pour. It shouldn't pour if it's the appropriate texture. So there's different reasons why we might change somebody's liquids. Again, if it's moving too fast and it's going into their airway before they're able to swallow, that could be a problem. They could develop pneumonia. If they're spilling it out of their mouth because they can't control it because it's too thin, that could be a problem. And so we want to take all of these into consideration. Now, thickening liquids is not the first idea, because I know I don't want to drink my coffee at a honey texture. I want to drink my coffee normally. And so we can try other things from a therapeutic standpoint before we thicken someone's liquid. So that's when we pull in our resources of our other discipline friends. So I could ask occupational therapy to come in and do a consult with me and see if we can change the way the patient's positioning. Can they tolerate sitting edge of bed for drinking? Can we elevate the head of bed? Can we change just trunk control and neck postures to try to get a more safe position for swallow? We can try that. We can try just basic exercises with the swallow the speech therapist can do. Sometimes we can have them tuck their chin down to their chest to kind of get more control. Sometimes we can have them swallow twice. There's a couple different things we can try. So we always want to try those things first, but sometimes those just don't do enough, and we do have to thicken liquids to protect the patient's lungs so that nothing's getting in there to develop pneumonia. So that might be a situation where you see a thickened liquid. Now, if a patient's on a thickened liquid, usually the goal is to see what can we do to improve the patient's overall functioning so we can move back towards thin liquids, regular liquids, as thin as possible, as quick as possible. So let's talk about food options now. So a regular diet is just what we would eat normally every day. Hamburger, chips, bread, sandwich, pasta, hard vegetables, all of the things that you probably aren't even thinking about would be considered a regular diet. So let's start from the bottom of a diet. So this would be called the most restrictive diet, meaning it's the most far away from normal. So it's the most restrictive. So that would be called a puree diet. So if any of you have ever been babysitting or around babies and seen baby food, I hate to use that description, but it's basically everything's blended and pureed. So we're thinking everything's the texture of applesauce, maybe some pudding. Everything is one consistency. It's all blended up. You should be able to eat it with a spoon and not really have to chew it. Okay? Which that might also be a reason somebody's on a modified diet if they're having problems with their teeth or their dentures, or something's not right to where they really can't chew those hard textures. Sometimes we have to go down a level just to make it easier for them to chew and swallow. So the next level up from a puree would be called a mechanical soft diet. And basically everything in a mechanical soft diet could be ground up in a food processor. So if you've ever done ground meat for spaghetti or tacos where you're kind of mashing that meat up, that should be the consistency of all meat in a mechanical soft diet. Everything's ground up in small, really easy bite-sized pieces. The goal with this diet, again, is ease of chew. We want them to be able to chew pretty easily and not have to work too hard to create a bolus, which is the term we use to talk about the ball of food in your mouth. We want them to be able to chew that pretty easy and have an easy swallow when they try to push that down. The next step up would be called a soft or chopped diet. So it's pretty close to regular, but everything's going to be kind of in bite-sized pieces, like the size of a nickel, maybe a quarter. So if the patient's getting a chicken breast or something like that, it's going to come pre-cut into small pieces. Again, this can be for ease of chew. We want them to kind of create a nice, easy swallow and kind of form it cohesively to when they swallow it, it all stays together and goes down nicely in the esophagus to the stomach. And then if the patient can tolerate that, the next step would be a regular diet. Just no modifications, just whatever they can want to eat. So when we're talking about thickened liquids or modified diets, there's a couple different systems that different facilities use to classify those terms. The most popular right now and widely used is called NDD, the National Dysphagia Diet. So those diets that I just listed off, those terms fall under that NDD category. But the last couple of years, a new system has come out. And so we want to make sure we're familiar with both, because depending on what facility you work at, you might be asked to use a different system. The texture should be the same, right? If I mix it under one system or the other, the texture, the thickness should be the same. We're just calling it something different. So we have the National Dysphagia Diet, which is our puree, mix soft, and regular. and our nectar thick and honey thick kind of fall into that as well. And then another system that just came out a few years ago is called the ITSE system. It's the International Dysphagia Diet Standardization Initiative. So it's IDDSI. If you can just remember ITSE, that's really all you need to remember. That just stands for the IDDSI. We just call it ITSE. And that system uses a combined approach, so where everything's in one system from thin liquid up to regular textures. And so that system uses a level of number. So instead of saying a soft diet, it would be like a level 6 for ITSE. And so one of the things that we're going to work on our texture day is just kind of seeing how those diets play together. And when you have a texture, what is it classified under the NDD? What is it classified under ITSE? Because we want to be familiar with both, because we just don't know what system the facility that we're going to end up working at is going to use. The purpose of the texture day when we're in person is to get your hands on these textures, see what I'm talking about. What do they feel like? What do they look like? If you try to pour a nectar thick liquid versus a thin liquid, you should be able to see a difference in speed of the flow, right? So we're going to go through each station and each texture, so you'll get to see what I'm talking about. And I really want you guys to be thinking about, in your specific discipline, what does this mean for me? Okay, if I were to see a patient that's on nectar thick liquids as an occupational therapist, what might that mean for my therapy session? Okay, if I am in nutrition and I see a patient just got admitted to my facility that's on a puree diet and honey thick liquids, what might that mean for me? What are some thoughts that might initially come to my head? And for nursing, when you get a new admit and you see this diet order of puree and nectar thick on the patient's intake form, what does that mean for you? Or for nursing, if you have a patient on a regular diet and you start to see some signs and symptoms of swallowing problems, what does that mean? What are some other disciplines that you could pull in to help assess that patient? Okay, we really want to be working as a team, because in these facilities and hospitals, one discipline just can't manage that patient by themselves. We really want to have the specialties of all of our friends be able to give best practice and a holistic practice, so we can treat that patient all the way around. So I'm so excited for you guys to get your hands on these textures and get to see what we're talking about, and really just kind of put some dots together when you think about what might it mean in the field that you're working in if a patient's on a modified diet or thickened liquids. I'm so excited to see you guys. I'll see you there, and we're gonna have some fun.